Hi everyone, to our YouTube channel Pharmaforge, and today we are going to discuss the topic that is anti-epileptic drug. Anti-epileptic drug are those drugs that are used in the treatment of the epilepsy or convulsion or attack of seizures. Uh, in Hindi we say it as a drug that are used in treatment of mirgi. Epilepsy is a recurrent episode of a seizure, and it involves the loss of consciousness. Epilepsy is of mainly two type. Actually, it is a neuro hyperactive disorder. Uh, when brain activated in more amount, it it causes epilepsy. Epilepsy are of two type, that is, one is a generalized seizure and another is a partial seizure. There are mainly two type of the epilepsy. One is a generalized seizure and another is a partial seizure. Generalized seizure, they are further classified as a generalized tonic clonic seizure. Then second type is atonic seizure. Third type is a myoclonic seizure. Fourth is absent seizure, and another is a infantile seizure. Generalized tonic-clonic seizure involved the alternate contraction and relaxation of the body. They are also called as grand mal epilepsy. Atonic seizure, it involves the relaxation of the body for prolonged duration, and in case of myoclonic seizure there is a prolonged contraction of body occur. Absence seizure, it is associated with T type of calcium channel. And last is the infantile seizure. Infantile seizure are found in the, infants, in neonates. And next type of the epilepsy is a partial seizure. Partial seizure, these are of two type, that is simple partial seizure and another is a complex partial seizure. Actually, seizure occurs due to the increase postsynaptic excitatory potential. So that increase postsynaptic excitatory potential, it need to be balanced, and for that excitatory inhibitory postsynaptic potential need to be increased. So the overactiveness of the brain, or as we say that it is neuro hyperactivity disorder, it need to be controlled, and this is done by the anti-epileptic drug. Those drugs that are used in the treatment of the epilepsy, they are called as anti-epileptic drug. First is a barbiturate class drug. It involves drug like phenobarbital, deoxybarbiturate class drug, that is primidone, hydantoin class drug phenytoin, aliphatic carboxylic acid, valproic acid, succinamide, ethosuximide. Ethosuximide is a drug of choice for the treatment of the absence seizure. Absence seizure also called as petit mal seizure. And immunostilbene derivative carbamazepine, then cyclic GABA analog gabapentine. Um GABA is a inhibitory neurotransmitter in our body. So in case of seizure, there is a increased level of the excitatory neurotransmitter in our body, and in brain it is necessary that the level of the inhibitory neurotransmitter like GABA, it need to be increased in case of in case of seizure. The cyclic GABA analog like gabapentine are useful, and benzodiazepine class drug, that is clonazepam, diazepam, lorazepam. These drug are benzodiazepine class drug are they are with GABA facilitatory action. GABA is an inhibitory neurotransmitter in our body. This drug also used in treatment of the insomnia as a sedative hypnotic class drug. So all this is about the classification of the anti-epileptic drug. Uh, and as per as their mechanism of action, this anti-epileptic class drug, uh, as a first is a, on the basis of their mechanism of action, first is a those drug that prolong the sodium channel inactivation. uh, as you can see in the diagram, there is a two green color structure, or you can say ligand gated channels through which the sodium is entering, uh, and this those drug that prolong the sodium channel inactivation, means it prolong the duration for which sodium channel is in the inactivated state, and because of that sodium cannot enter through that channel. Whenever there is a entry of the sodium occur through any ionic channel, it is responsible for the depolarization. Sodium is responsible for the depolarization, means depolarization means positive charge come inside the cell, and it lead to the action potential. And in case of seizure, there is a generation of the repetitive action potential occur, and that repetitive action potential, it need to be minimized, it need to be controlled, and that's why prolongation of the sodium channel inactivation is necessary. It will suppress the entry of the sodium, it will decrease the generation of the action potential, uh, and decrease in the symptoms of the epilepsy. So under this class, drug like phenytoin, carbamazepine, valproate, lamotrigine, topiramate, zonisamide and lacosamide. Zonisamide, lacosamide, topiramate, these are newer drug. These are a newer drug, but phenytoin, carbamazepine and valproate, these drugs are very common drug. Then as you can see in the diagram, next is a facilitation of a GABA mediated chloride channel opening. As we know, that is a GABA or glycine or dopamine, these are inhibitory neurotransmitter in our body, and GABA is a main inhibitory neurotransmitter. Its role in the sleep is also important. uh, so those drug that whenever there is a decrease in the level of the GABA, it lead to the hyperactivity of the brain, it causes insomnia, or when its level decreases, it causes seizure. So the level of the GABA must increase in order to uh, give relax to the brain. So drug like barbiturate, benzodiazepine, then vigabatrin, valproate, gabapentin, tiagabine, all these drugs that facilitate the action of the GABA. Barbiturate and benzodiazepine class drug are used as a sedative hypnotic drug. Um, Barbiturate and benzodiazepine both act on the allosteric site of the GABA A receptor. GABA A receptor, it is a ligand gated channel. It and barbiturate, they bind on the alpha beta interface, and benzodiazepine, they bind on the alpha gamma interface of that receptor, and they facilitate or they mimic the action of the inhibitory neurotransmitter, that is GABA. And other drug like vigabatrin, valproate, gabapentin, tiagabine, they are also involved in the facilitation of the action of the GABA. Then next is the inhibition of the T type of calcium channel. T type of calcium channel, it is involved in the absence seizure, and this ethosuximide is a drug of choice for the treatment of the absence seizure. Then this is about the classification of the drug as per their mechanism of action. Then one by one, drug that prolong the sodium channel inactivation, means phenytoin, carbamazepine, lamotrigine, zonisamide, lacosamide. This drug bind to the voltage gated ion channel and prolong the state of inactivation of the sodium channel. Means they do not allow that sodium channel to get open, and that's why entry of the sodium cannot occur, and so depolarization do not occur. It lead to the stabilization of the neuronal membrane, and no repetitive generation of the action potential, means no seizure. In that, first drug is a phenytoin. Phenytoin is a hydantoin class drug, and phosphenytoin is its prodrug. And phenytoin is teratogenic drug. Teratogenic means those drug that creates the abnormalities in the fetus. Phenytoin is responsible for the fetal hydantoin syndrome. Next drug is a carbamazepine. Carbamazepine is a immunostilbene derivative drug, and it prolongs the sodium channel inactivation, and it is used in the trigeminal neuralgia. Uh, neuralgia means pain in the trigeminal nerve. And oxcarbamazepine, it is one of the analog or congener of this carbamazepine. And next drug is a sodium valproate. As you can see in the diagram, the name of the sodium valproate, it is mentioned in all of the three mechanisms. Means sodium valproate is a drug that act by all three mechanism. It can prolong the sodium channel inactivation, it can act as a GABA facilitatory, and it can inhibit the T type of calcium channel. So by all these three mechanisms, sodium valproate can act. This is one of the speciality of this drug, sodium valproate. But this drug is also teratogenic drug. It causes the spina bifida or neural tube defects in childs. Then next drug are drug with a GABA facilitatory action. Drug with GABA facilitatory action involve barbiturate, benzodiazepine, then gabapentin, then tiagabine, then vigabatrin. All these drug they are with a GABA facilitatory action. Barbiturate, as we discussed, barbiturate, they act on the GABA A receptor. They act on the alpha beta interface of the GABA A receptor. Barbiturate are with a GABA mimetic action as well as GABA facilitatory action. And on the other hand, benzodiazepine act on the alpha gamma interface, and benzodiazepine class drug are with only GABA facilitatory action. Means they can only facilitate the entry of GABA. But barbiturate in higher concentration, they can itself bind to the GABA receptors. Then next drug is a gabapentin. Gabapentin increases the release of the GABA. It evokes the release of the GABA. GABA is a inhibitory neurotransmitter, and that's why its concentration in the synaptic cleft when increases, it lead to the decrease in the hyperactivity of the brain. And next is a vigabatrin. Vigabatrin is a drug that inhibits the GABA transaminase. GABA transaminase is a agent that is involved in the degradation of the GABA. As we discussed that in case of the noradrenaline, the MAO-A, it is involved in the degradation of the noradrenaline. Then in case of the dopamine, MAO-B, it is involved in the degradation of the dopamine. So in case of the acetylcholine esterase, it is involved in the degradation of the acetylcholine. Like that, when GABA come in the synaptic cleft, its degradation is necessary. So it is performed by the GABA transaminase. But in case of the seizure, the level of the GABA need to be increased in the synaptic cleft, and that's why drug like vigabatrin that inhibits the degradation of GABA are given to patient. Then tiagabine inhibit the reuptake of GABA. Reuptake means when reuptake is inhibited, automatically the level of the GABA increases in the synaptic cleft. Here I have explained it by the simple diagram. You can see this is one is a presynaptic membrane, another is a postsynaptic membrane, and GABA is stored in the vesicle. And one by one, that is gabapentin increase the release of the GABA. It increase the release of the GABA. Then vigabatrin inhibit the degradation of the GABA by GABA transaminase. GABA transaminase, it is involved in degradation of the GABA, but when GABA transaminase it is inhibited, automatically the level of the GABA increases in the synaptic cleft. Then tiagabine, it inhibit reuptake of GABA from the synaptic cleft, and because of that level of the GABA increases in the synaptic cleft properly. Then another drugs are barbiturate and benzodiazepine. They act on the GABA A receptor and causes entry of the chloride through the chloride channels, and it lead to the hyperpolarization and finally lead to the sedation or decrease in the activity of the brain. So this is in brief about the drug that are with a GABA facilitatory action. Then drug that act on the excitatory neurotransmitter. As we discuss that glutamate or glutamate or dopamine, these are inhibitory neurotransmitter. Glutamate and aspartate are excitatory neurotransmitter in our body. Glutamate and aspartate are excitatory neurotransmitter in our body. So the activity of this excitatory neurotransmitter, it need to be decreased in case of epilepsy, because epilepsy occur due to the imbalance in between the excitatory postsynaptic potential and inhibitory postsynaptic potential. Drug like felbamate or felbamate are given in case of the inhibition of activity of the glutamate on NMDA receptor, because glutamate, it is excitatory neurotransmitter, it bind to the NMDA receptor. So when felbamate it bind to the NMDA receptor, glutamate cannot bind to it, and activity of the excitatory neurotransmitter, it is inhibited. Then next is a drug that act on the T type of calcium channel. Ethosuximide is a drug of choice for the treatment of the absence seizure, or we can say petit mal seizure. Along with that, sodium valproate, zonisamide. This drug can also be used in the inhibition of the T type of calcium channel. And zonisamide is a carbonic anhydrase inhibitor drug. Uh, this is about the anti-epileptic drug. Classification of the anti-epileptic drug is important. That is barbiturate, phenobarbital. You can remember that in case of sedative hypnotic, barbiturate and benzodiazepines are used. Like that, in case of treatment of seizures, barbiturate and benzodiazepine are used. Other than this, drug like valproic acid is a drug that act by all three mechanism of action. Means it can prolong the sodium channel inactivation, it can show the GABA facilitatory action, and it can inhibit the T type of calcium channel also. uh, and succinamide derivative, that is ethosuximide, it is used in the treatment of the petit mal seizure. Then uh, newer drug, it include topiramate, zonisamide and lacosamide. In that, remember, topiramate is an anti-epileptic drug that on prolonged use causes weight loss. So you have to understand what is actually epilepsy or types of epilepsy. That is, epilepsy is of mainly two type. One is a generalized seizure, and another is the uh, partial seizure. In case of generalized seizure, it is further classified as a generalized tonic clonic seizure. Means alternate contraction of the body, alternate contraction and relaxation, contraction relaxation occur in body. In case of atonic seizure, patient show relaxation of the body for prolonged time. In case of myoclonic seizure, patient show uh, prolonged contraction of the muscles. And in infantile seizures are found in the infants, and absent seizures is a loss of consciousness in a patient for less than 30 minutes. Then next is a partial seizure. Partial seizure is of two types, that is a simple partial seizure and complex partial seizure. Overall, in case of the epilepsy, the excitatory postsynaptic potential in the brain, it increases, uh, and it lead to the loss of consciousness. So that excitatory postsynaptic potential, it need to be minimized. And the mechanism that we use in the treatment of the epilepsy is the prolong the inactivation of the sodium channel. Means when the entry of the sodium is inhibited, it lead to the inhibition of the depolarization. Depolarization is inhibited, and so repetitive generation of the action potential, it is inhibited. Three mechanisms are involved in the anti-epileptic drug, that is prolongation of the inactivation of the sodium channel, then the facilitation of the action of the inhibitory neurotransmitter like GABA, and inhibition of the T type of calcium channel, uh, and along with that, inhibition of the excitatory neurotransmitter should be inhibited. Inhibitory neurotransmitter should be they should be promoted, and along with that, inactivation of the prolongation of the inactivation of the sodium channel. So these are three main mechanism of action in case of anti-epileptic drug, and their names are also given, that is phenytoin, carbamazepine, then lamotrigine, topiramate, zonisamide, lacosamide. So this is about the drug that prolong sodium channel inactivation. And next is a drug with a GABA facilitatory action. In this drug with a uh, new mechanism of action, that is tiagabine and vigabatrin. These two drugs are important. Vigabatrin inhibit the degradation of the GABA, and tiagabine inhibit the reuptake of GABA. Both result in the increase in the concentration of the GABA in synaptic cleft, and it is explained with this figure. And uh, other drugs are drug like felbamate. Okay. And only